So everybody needs to know the results of this test, the coronary artery calcium score, CACS. Some people call it the CACS test. I don't. About 80% of hospitals in the United States offer this test, and many in Canada. In most states, you have to pay cash. I'm aware in Texas and maybe Hawaii, your insurance will cover one routinely around age 50. You need a prescription from a healthcare provider. That's a blockade because some of them won't do it. I hear this story over and over. My family doctor would not give me a script. They thought I was too low risk, and then the test comes back abnormal. But if you look to the left, panel A, the yellow arrow is pointing at heart arteries. No white spots, no calcification. Good news. Panel B, yellow arrow, white spots, calcification. That's that moderate disease we're picking up. No symptoms, normal stress test. Never find it on a physical exam with a stethoscope. And boy, oh boy, pickleball player number C. I have pickleball players just like number C. Their arteries are basically stone, rock, calcified, but they feel okay. And sometimes they even pass stress tests. They don't all need bypass or stents, but boy, they are, if you were staging their cancer, heart burden, very advanced. They need therapy big time, and we'll help them with that. So this test takes about 1 minute. It should cost about $100. There's no IV, there's no injection, you can't be allergic, and you really can't be claustrophobic because the CT scanner is nowhere near your face and it's not tight near your body. And the radiation exposure is very, very low. Heart disease takes more deaths than any other cause in the United States. We should take a little risk and a little expense and get this done. And this is what you want to see. That in this case, 4 major arteries, and then point number 5 is the total. Everything is 0. This was my report about 3 years ago. I do this about every 5 to 7 years, so 0 is great. I've done this since age 40. I'm turning 65, so I'm glad to keep this a 0. And there's so many research studies. There's about 6,000 research studies on coronary artery calcium scoring. And the power of 0 for extremely low risk of stroke, heart attack, congestive heart failure. And it also seems to indicate good health body-wide. Brain disease, kidney disease, lung disease, all are lower in people with a coronary artery calcium score of 0. You're probably good genetics and good lifestyle for a long time. This is AHA, if you look in the upper right, is the American Heart Association. And although that Shape Society was way back about 18 years ago, if you go way down where the red circle is, it's really small print. I'll read it for you. But it says, if you have a CAC, a coronary artery calcium score of 0, you may not need statins. So your doctor says to you, your cholesterol is 230, Joe and Jane. Here's your prescription for rosuvastatin. And you say, I feel wonderful. I heard a lecture by a Dr. Kahn, and even the American Heart Association now agrees. Give me a script for a coronary artery calcium score. Let me find out if I'm a 0 or a 300. If I'm a 0, I'm not sure I want to take that prescription drug. I'll eat more ground flaxseed and broccoli sprouts. And if I'm a 300, okay, you win. I get that maybe I should focus on chemotherapy for my heart disease. All right. Here's that carotid study, CIMT, the machine to the left, the patient very nicely volunteering her picture with a probe on the neck. Very simple test, no radiation. But it's not just seeing the plaque, it's also measuring the T, the thickness of the artery. It takes special digital and AI-enhanced software to do all that, but it's been around for a long time. About 2,000 research studies say this is a good test. And this is an example of a report. On the top of the picture, there's a right carotid artery with 1 small plaque, less than 20% narrowing. On the top left, there's 1 larger plaque, 3.623 millimeters. Heterogeneous means it's a mixture of hard and soft plaque, less than 20% narrowing. And this person was 56 years old, and their arteries, the thickness was more like a 60-year-old man. So we got some work to do here. Not tragic news, but you can repeat this scan in a year and see these numbers improve, and sometimes see the plaque disappear. This is what you'd like to have, a right carotid and a left carotid that show no plaque. And if you look below, a 60-year-old driver's license age, but the arteries look like a 51-year-old. That was mine about 5 years ago, and I'll see what this newest one comes out during the week when I get the results back. Hoping to keep it clean and young, but we all are at risk. Cardiologists are not immune from heart disease. Sadly, many cardiologists, we just had one in Detroit 6 weeks ago, dropped dead. Suddenly, you're going to presumably of a sudden heart attack, and we're at risk too. So it feels so good to know the score. The sweaty guy on the left knows his calcium score is 0, and I'd certainly introduce women in this picture too. But the guy in the red has no idea what his calcium score is. That's basically leading life without your without your seatbelt on. That is a risky approach. And again, I'm urging you all to be more aggressive. So, action step. Colonoscopy, or maybe you do the stool test called Cologuard, mammogram, or maybe you do the test, the thermogram, and check the box. Check the box this week. Go to your primary care doc and say, I've never had a bypass, I've never had a stent, never had a heart attack, but I've never had a calcium score, and I'm living life blind, and I'm going to step up my war on heart disease and see where I'm at. All right. Paradigm shift, change from one way of thinking to another. Humans resist that. But attacking heart disease like cancer, fighting heart disease like cancer is now the new paradigm. So I want to talk to you about a new paradigm out there. This is a physician. You won't really know much about him unless you're a cardiologist. But at the Cleveland Clinic, Dr. Mason Sones, a year before I was born, found out that with a little catheter put in that case from the arm, later on from the leg, and later on from the wrist, he could make pictures of heart arteries. And those heart arteries are called coronary arteries, and the test was called a coronary angiogram, or a cardiac catheterization. Some of you in the audience have probably had a cardiac catheterization, and you need to thank the Cleveland Clinic legend, now deceased, Mason Sones, for that. But this is the problem. The red arrow is pointing to an area that is narrowed compared to the area after it, and a little bit compared to the area before it. This is a heart artery. It's called the right coronary artery. Since the introduction of cardiac catheterization, this has largely been measured by visual estimates. That looks about 50% blocked. But even if you look below, that means 40 to 70% blocked. And research studies show, this is a secret of cardiology, that we're not very good at agreeing on how much blockage there is. When we get a group of cardiologists and look at this film, and we have them quietly write down on a paper what they see, the numbers are all over the map. Yet, we're using this invasive test to pick people for stents and bypass. And one cardiologist writes down 30%, and one cardiologist writes down 80%. And one patient gets a stent, one patient goes home with an aspirin. So this is not just my opinion, but these are two papers in the 1970s that talk about the variability in coronary angiography. And they basically did take a series of catheterization films and a series of experienced cardiologists. They had them write down what they saw, and they published the data, and it's a very concerning high degree of variability, 30 to 90% for any single lesion. So about 2010 came a new technique that did not require putting a catheter in the body. So it goes back to our CT scanner, one of the tools of the preventive cancer treating, heart disease treating cardiologist. Coronary CT angiography. And if we do a CT of the heart, but we inject iodine dye through an IV, we can now see the arteries without putting a catheter in the body. So this is a test that is now about 14 years old. And you can see an artery to the left in green with no coronary artery disease. And this is typically how these are reported at the hospital. Less than 25% narrowing, the yellow one, 25 to 49%, the orange one, 50 to 69%, the lighter red one, and then the darker red one over 70. But these are still visual estimates. These are best attempt. And when you get 5 cardiologists looking at the same CT angiograms, you're going to get different numbers. You can't help it. So that was 14 years ago. But over the years, the word everybody hears all the time now, AI, artificial intelligence, became applied to these CT angiograms. Interestingly, it's not yet really routinely applied to heart catheterization, the invasive test, but it's routinely available. I've ordered hundreds and hundreds and hundreds of artificial intelligence coronary CT angiograms on people all over the United States because I'm licensed from coast to coast. And I have patients from California, New York, and Florida to Minnesota. And we can measure, as this picture shows, using a computer that draws these yellow lines and purple lines. And the computer will measure, independent of the eyeball, how much plaque there is. And also can tell us what kind of plaque. You won't be quizzed on this, but there are plaques at the top, a necrotic core plaque with a red asterisk that's very high risk for heart attack. I had a patient yesterday morning in the clinic, and I showed him his data on his AI coronary CT angiogram with a necrotic core high-risk plaque. Or you can go way down to the bottom in green, where you have a plaque that's completely heavy calcium. And it's abnormal, it's atheroma, it's a tumor, but it's a much lower risk. So this is a revolution. This is a paradigm shift. This is the best test on the planet that everybody can have done if they're appropriately screened for and can afford it, because insurance doesn't always pay for it. And you can see the arrow just popped up. The top one is the high risk, and the calcified dense area is low risk. So not all plaques are the same. We can't tell this in the heart catheterization lab. Isn't that amazing? It's this artificial intelligence CT scan that tells us, if you look to the left, that red plaque is that high risk, low density necrotic core, maybe a heart attack coming plaque, like I shared with my patient yesterday. And way to the right, color coded in blue, is calcified plaque, hard plaque, old plaque, not normal, but probably not going to cause a heart attack. And the ones in the middle are a mixture of yellow being non-calcified fatty plaque with some calcium mixed in. We can do this routinely now in the heart arteries.